Hi everyone, welcome to your Foundations with the Fellows. Now I will be teaching you Spencer's technique. Spencer's technique is a technique for the shoulder girdle. Alright, so it's important to perform this technique in a certain order, and the way I remember this order is through the mnemonic EFC, add Abbott. E stands for extension, F stands for flexion, C stands for circumduction, add stands for adduction, ab stands for abduction, I is for internal rotation, and T is for traction. So you're going to stand behind your patient when you first start off, grab the clavicle and the scapula, stabilizing it with your fingers and your thumb. You're going to grab the arm and first bring it into extension. And with each of these techniques, you can either do articulatory or muscle energy. So for extension, I'd pull him back into his feather edge, and I can either articulate through that, or I can do the muscle energy modification. So I would say, Phil, can you flex your arm forward for me? 1, 2, 3, 4, 5, and release. Wait a second, and pull it back further into the feather edge barrier. Next is flexion. So pull him into flexion until you feel that feather edge barrier. Have him pull down for muscle energy and release, pull up further, or you can do articulatory, pulling it further forward into flexion. Next is circumduction. With circumduction, you do compression and then traction. So first, remember that you keep stabilizing that shoulder girdle, and then you press down on the elbow for compression, and you move it into either counterclockwise or clockwise circles. Next, you pull up on the arm and continue that circumduction, but with traction this time. Next, we have adduction with external rotation. So I'll come over here. I'm going to stand in front of him, but just for purposes of the video, I won't stand right in front, but you can usually stand right here. Continue grabbing onto the clavicle and scapula. Have the patient grab your forearm and induce an adduction as well as an external rotation. You can push down articulatory or have your patient push up into your hand and release, further going into adduction. Next we have abduction. Stabilize again, clavicle and scapula. Pull him up into abduction. I'm going to have him pull down into adduction and release, pull up further into your feather edge barrier. And I like to combine muscle energy with articulatory. I think it has a nice way of treating. And last, we have internal rotation. So have your patient put their hand behind their back, continue stabilizing, push on the elbow forward. A lot of patients aren't able to put their arm into this much internal rotation, so just be gentle and make sure you're not forcing them into anything that's uncomfortable for them. I'm going to have Phil push back into my hand and relax and further forward. Last, we have traction. And I'll come over here. Hopefully you can still see. Yeah, here we go. So I'll have my patient grab onto my shoulder, clasp your hands, and I like to use the edge of my pinkies to grab at the top of the deltoid insertion and pull. So this is your traction. This feels really good. Another modification is you can grab your hands all the way around their arm and pull that way as well. If you want to do the muscle energy modification, I would have my patient push down onto my shoulder and relax and pull further up. If you want to add a little extra bonus, you can kind of milk the arm all the way up, and it feels pretty good. That is your Spencer's technique foundation with the fellows.